This presentation is an overview of a book chapter, Emotions and Betrayal, closely looking at the effects of betrayal and treatments. What is betrayal? According to Reichman, betrayal is commonly defined as a phenomenon of intentional act of harm by a close or trusted person. Betrayal is also associated with a myriad of long-term consequences, which can be life-altering and permanent. The higher the degree of betrayal, will more likely experience the increased intensity of adverse effects of betrayal. To concur, reducing the distrust among victims is therefore extremely difficult to achieve. There are three categories in the emotional effects of betrayal: psychological, behavioral, and biological. Individuals who experience the act of betrayal elicit adverse psychological effects. Initially, shock, loss, and grief, damaged self-esteem, self-doubting, and anger arise from betrayal. The more intense and catastrophic betrayal are most relevant for psychological disorders. Behavioral effects are people who suffer from the act of betrayal are more likely to display behavioral changes. Study shows that people normally show signs of paranoia, develop eating disorders, and develop obsessive compulsive disorder. This is due to the emotional suffering that emits from the act of betrayal. A hormone called oxytocin plays an important role in trust and betrayal, as it influences the brain on how people deal with betrayal. When trust is compromised, the brain emits a specific activation pattern, and when oxytocin was presented, activation was significantly reduced. This part of the brain is responsible for the fear and behavior when one is experiencing anything kind of negative behavior. Behavioral trauma theory is the cognitive disassociation of the victim towards the perpetrator of their wrongdoing. Victims who experience interpersonal trauma repress their memory and is unlikely and aware of the trauma to maintain critical attachment bonds to the perpetrator. Treatments for the effects of betrayal are cognitive behavioral therapy, which mainly focuses on the combination of thoughts, feelings, and behavior of an individual that teaches them to overcome and control its emotions and behaviors. Group therapy is also a highly effective form of psychotherapy that is based on interdependence and interactions among group members. To conclude, betrayal causes adverse effects due to the magnitude and degree of the betrayal. Emotional effects of betrayal can increase the onset of psychological disorders. This disorder ranges from anxiety disorder, obsessive compulsive disorder, and post-traumatic stress disorder. Betrayal trauma theory is also the effects of betrayal, wherein victims of betrayal abuse repress their memory to maintain the relationship with the perpetrator. Different treatment strategies such as cognitive behavioral therapy and group therapy are readily available.